Hi everyone, I'm Sanjida Chaudhary and welcome to MEMcast PACES Resources. This session is aimed at candidates who are preparing for the PACES exam. In our last video, we demonstrated neurological examination of upper limbs in Station 3. In this video, we will look at how to interpret and present clinical findings in the neurological exam, along with the clinical discussion with the examiners. Hi, I'm Sanjida Chaudhary, one of the doctors. I've been asked to examine your arms today. Is that all right with you?
Yeah.
Thank you. Are you in any pain at this moment?
I've got a little bit of pain in my upper leg. I get a bit of pain in my hand.
Okay, thank you. Please do let me know if you feel uncomfortable at any moment. Would you mind to take off your shirt for me, please? Thank you so much. Will it be all right if you outstretch your arms, palms up, cock your wrist back? Thank you. I'll have a close look. Can you close your eyes now? I'll have a look at your hands. You can open your eyes now. Thank you. Can you put your arms down? Thank you. I'll have a look into your arms. Is that okay?
Yeah.
While I'm doing this, can you raise your arm up and down for me, please? That's fine. Thank you. On the other way. That's fine. Thank you. Can you do like this for me? Yeah. I'll push you down. Don't let me push it, okay? Push me down as strong as you can. Well done. Can you flex your forearm like this for me? Pull towards you, please. Thank you. Push me away as strong as you can. Thank you. Pull towards you, please. Push me away as strong as you can. Good. Can you outstretch your arm and put your wrist back to like this for me? Thank you. Press against my hand as strong as you can. Good. Push me down as strong as you can. Well done. Good. Spread your fingers like this for me. Thank you. Press against my finger, please. Thank you. Press against my finger. Thank you. Press against my finger, please. Press against my finger. Thank you. Can you squeeze my fingers tight? Tight, 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 tight. Good. Well done. Thank you. I'll now check your reflexes. I'll use a tendon hammer and gently tap on your tendons, okay? Thank you. Just relax your arm. This is a neuro tape. This is sharp, but it won't break your skin. I'll put it down in your forehead so that you know how sharp it is. I'll do the same on your both arms, and if you just let me know if you feel the same sharpness on both hands, and if you feel blunt in any moment, please do let me know. Yeah. Thank you. Thank you. This is your thumb, and it's up and it's down. Please do let me know if it's up and down, okay? Can you close your eyes for me, please? Thank you. You can open your eyes. So this is a tuning fork, and it will vibrate like this. Okay, I'll put it in your forehead so that you know how the vibration feels. If you feel the same vibration in both of your thumbs, just let me know, okay? And let me know when it stops. Thank you. Can you now touch my finger and touch your nose for me? Yeah. Back and forth. On the other hand. Thank you. Can you swap your arm on the other hand, just like this for me, please? Quick and as fast as you can. Thank you. Now with the other hand. Thank you so much for your cooperation today. I'm done with my examination. I'd like to finish my examination by looking into the observation charts, especially temperature, blood pressure, and I'll also like to do the fundoscopic examination. Thank you, sir. You can put your t-shirt back.
Can you please present your findings?
Yes, thank you. This is a case of upper motor neuron type of weakness, which is evidenced by increased tone bilaterally, more on the right side, reduced muscle power bilaterally and distally, more on the right side. The sensation of pinprick and proprioception are intact. Coordination is intact.
Do you know of any conditions that might cause this?
Yes. So there are a few conditions that can be causing such upper motor neuron type of weakness. If it's an acute episode, then we can consider vascular lesions like stroke. If it's a subacute episode, then we can consider neuroinflammatory conditions like multiple sclerosis, neurosarcoidosis, infective causes like Lyme's disease, and space-occupying lesions like tumor.
What would be your main differentials?
Considering that it's bilateral, my top differential would be multiple sclerosis.
Okay. How would you investigate this?
I would like to do some further bedside examinations, like examinations of lower limbs, fundoscopic examination, and examination of the cranial nerves. I'd also like to arrange some blood tests, like full blood count, urea and electrolytes, liver function tests, clotting profile, blood glucose. To confirm the diagnosis, I would like to arrange an MRI brain scan with contrast to look for any inflammatory lesion in the brain. I would also like to do a lumbar puncture to send the CSF for analysis like protein and spatially oligoclonal bands. I would like to send bloods to look for glucose, protein and oligoclonal bands to pair with CSF. Okay. We can do some visual evoked potentials, some neurophysiological tests to further diagnose the condition.
Okay. Can you tell me more about the management of multiple sclerosis?
Yes, sure. So if it's an acute episode or an acute relapse, then we can treat the condition with corticosteroids to tackle the neuroinflammation. We will prescribe the steroids for 3 to 5 days. And if it's a relapsing remitting condition, and if the relapses are happening frequently and disabling, then we can refer the patient to multiple sclerosis MDT team to consider for disease modifying treatments.
Are you aware of any disease modifying drugs that are available to treat multiple sclerosis?
Yes, there are a few first line treatments which include interferon beta and glutamine acetate. There are some second line treatments like fingolimod. There are some third line treatments which you use only when the first line and second line treatments are not helping with the symptoms. And these are dimethyl fumarate, natalizumab, which is also called as Tysabri.
Any other supportive measures that you can help the patient with?
Yes, sure. The patient can present with spasticity. If the patient presents with spasticity, then we can give the patient baclofen to help with the symptoms. If the patient presents with urinary symptoms like urinary incontinence and retention, then we can try few cholinergic treatments to help with the symptoms.
Okay. Is there any role for occupational therapy or physiotherapy in patients with multiple sclerosis?
Yes, of course. If there is any symptoms which is interfering with the daily lifestyles, then we can refer the patient to occupational therapy and physiotherapy to help with the symptoms. Okay. MEMcast have some other MRCP related material. There are MCQs and facts of the week over on our Instagram page at MEMcast, and we have weekly podcast episodes available on streaming platforms. Good luck with your exam preparations from everyone here at MEMcast.